everyone, welcome to The Beauty Matters with me, Lin Hussin, on ALB UK TV. Who doesn't want a Hollywood smile? Who doesn't want an amazing smile? And for that reason, we are joined by Dr. Kamala to tell us more about it. Hello, doctor.
Hello.
Thank
Hi.
you so much for being with me today.
It's a pleasure. It's a pleasure.
Dr. Kamala, I've introduced you as a dentist, so if you can tell us a little bit about your background. I know everyone wanting to listen about the big topics, but it will be lovely to hear about your background first.
Yes, absolutely. So I'm a general dentist in London, and I have over 14 years experience in cosmetic and restorative dentistry. So ever since I was little, I loved all the beauty and fashion and smile. And when I became a dentist, I decided to kind of combine these two passions in one. And that's how I kind of leaned towards more cosmetic dentistry, providing all these teeth whitening, veneers, and all these desired kind of treatments. And
yeah, because it involves the fashion and the designing with it.
Exactly.
What's trendy.
Exactly, because to give a patient a nice smile is actually, it does mean to design it. So you kind of need to have this really nice eye towards the designing beautiful smile, to what looks good on you, because different things suit different people in different ways, you know.
Yeah.
So you need to have that general kind of understanding and eye of it.
Maybe also to be more into art in a way.
In a way, correct, correct, because it's literally, it's very artistic job as well, because even with a simple tooth filling that we do, we always provide it in a natural way to reproduce the natural anatomy, to make it look just like your own tooth, so you wouldn't tell the difference between your tooth or the filling. So it's quite an artistic job as well, definitely.
Yeah, one of the very big topics now, teeth whitening. Everyone is interested. How can I have this like really bright smile?
Yeah.
Can you tell me more about teeth whitening, and is it harmful?
Yes, I definitely find this question is so popular nowadays. Well, ever since people got into, you know, all this social media and on TV, in movies, everywhere you see all these beautiful white smiles, and people want that. And this is one of the most desired treatments nowadays. Whether it's harmful or not, it really depends how you get it done. It's very simple. A lot of whitenings types, kits, and products could be harmful if they're used by people that just buy them over the counter. Some of them are quite, they could cause irreversible damage to the teeth. But if it's done professionally, if it's done in a way that it's controlled, and it's suitable for a specific patient, specific type of teeth, then it could be one of the safest treatments out there, and it could be quite predictable as well. In most cases, we would look at patients' teeth, and I would be able to tell what result we could achieve, what sort of journey you would have, and whether you would have any side effects there or not. So you can assess all that by having just a general dental examination and then planning this forward.
Talking about damage, what type of damage it causes? Is it like more of sensitivity, or
there is
deeper?
Yeah, very good question. There's a big variety of products that people use. So it depends what you decide to use. So there is. People use all sorts of funny things. I've heard people using like cider, apple cider, baking soda is commonly used products, you know. I think strawberry. Some people even think that this baking soda is the is the ultimate whitening product, you know. People use all sorts of things, charcoal, exactly, lemon. They squeeze lemon with water and brush their teeth, thinking it's going to get them whitened. Different sorts of fruits. The problem with all that is that what it does, the baking soda, for example, it has these little particles that when you scrub it across the enamel of your teeth, it grabs the stains with it, because it has these little rough particles. Yes, it does remove the stains from the surfaces of your teeth, but at the same time, it removes your part of your enamel with it.
Okay.
So it's quite abrasive. And because of that, although you may see some brighter results straight away, in few weeks' time, it's actually going to make the teeth darker because the teeth become rough and the stains accumulate even more. So my general recommendation to patients is always try not to use all these abrasive products. Same is with the teeth whitening paste. So when you use teeth whitening paste, what it does is literally having these little particles. They could be any chemicals in it, but these little parts that grab the stains off is basically how these pastes work.
And people use it for a long time.
People use every day for years, and I can see all this damage to the teeth, which unfortunately the tooth structure doesn't grow back. You know, it's gone forever. We can restore it then, but then it becomes dental problem. And it's, I always tell my patients, it's like if you're dark haired and you want to become blonde, you don't go and pluck your hair, you color it in white. Same here, if there's a color which you don't like, you don't try to remove and scrape it off, you just need to bleach it from dark to white. So it's very similar. And another thing to understand is that the color that causes teeth to be dark is inside, it's under your enamel, it's not on the surface. Therefore, by using all these kind of products, it's literally useless. It's not going to change anything. How the professional teeth whitening products work, on the other hand, they actually use this little amount of gel that's applied on the surfaces of your enamel, and it penetrates through the enamel into the deeper layers of your teeth and bleaches the stain. Basically, it makes the stain brighter and brightens up your smile. Therefore, it needs to be used properly.
So is there different types of teeth whitening, the safe one, or is it the gel? I heard of UV light one, so is there like difference?
There's variety, there's plenty, you name it. There's so many types of teeth whitening, but at the base of how they work, it's always the same. It's basically the teeth whitening component inside the gel, which is, in most cases, is hydrogen peroxide. Or carbamide peroxide. So what they do is, in the clinic, in professional environment, it could be either in-office whitening, where a patient comes in for 1 hour, maybe plus minus 30 more minutes, and sits in the chair. There is this gel that is being applied on the surfaces of your teeth, and the UV light or any other sort of light that's activating this gel to work. Now, the advantages of this procedure that is instant, it's just one-off procedure, and it does give you some brightening result. But the disadvantage is that because it's the result, because there's not much time for the gel to penetrate into the tooth, the result is mostly caused by dehydration of the tooth. Basically, you're laying down with open mouth, and the surface of the teeth dry out, and they look whiter. So it would stay for a few weeks, but then it would go back to what you had. That's why all this laser whitening that, you know, are being used in non-professional environments, they don't give you the long-lasting results.
And how long do you, like, are you able to leave yourself before you do the second whitening session? The safest way again.
So the recommendation is to either do this laser whitening if you want a quick result, but then complement it with the home whitening, but a professionally made kit. Basically, we fabricate the trays customized to your teeth that would incorporate gel areas in it where you could put the gel in and you could wear it every day for a few weeks at home. So that would enhance that result and also make it last longer. If you've done that, you don't really need to repeat this procedure anytime soon. You would have longer lasting white teeth.
And they will be able to repeat it once they want to.
And you can repeat it if you need to. Normally, depending on your diet, so if you have less staining diet, if you don't smoke, then your results would last longer. If your diet has lots of tea, coffee, which a lot of people have nowadays, so the tea, coffee, smoking, a lot of carbonated colored drinks and foods, red wine, those those components in your diet would make your teeth stain quicker. Therefore, you may need to refreshen this result maybe once a year or once in a few years. And also it's important how often you see a dentist or hygienist to clean your teeth as well, because those stains that are on the surface, they could just be cleaned before they go any deeper, you know, before they accumulate and need another session of whitening.
That's for the natural teeth, the people who they want to whiten their own teeth. But on other hand, now people want the very bright one, which is, you can't, I don't know if you can get it through teeth whitening, the one which is just perfect smile and perfect shape, size and color, very white.
Yeah. To be honest with you, I get this question a lot. First of all, people ask me, the whitening, is it safe? So yes, the answer is it is safe if it's used professionally and it's customized to your teeth. And the second question people ask, is it going to look natural? Now, some people who want it to look natural, it will. Because no matter how white you whiten your own teeth, it will always be your own teeth. It will be your shape. It will always be not very perfect. So they will always look natural, but brighter.
Yeah.
Some people now, on the other hand, nowadays, they want this picture perfect smile, you
Hollywood
know, where
smile.
exactly where you just smile and all of them look exactly the same, very white. Now that is inachievable with plain whitening. If you want your teeth to look slightly unnatural white, you know, then I had this patient the other day. She came to me. She said, "Can you give me the Photoshop white teeth?" You know? So she said, "I don't want to do any more Photoshop. I just want this Photoshop white teeth." Now, the answer is yes, but then it has to be something added to the surfaces of your teeth to make them more perfect.
Such as now?
Now, in most cases, it would have been the veneers. The veneer is a thin layer of a material that's been glued to the surfaces of your teeth. It's reminding, you know, the woman would know it's a shellac or the gel nail polish, where you add things to make your shape of your teeth nicer, more equal, and then you can pick any color that you like. So this is the name that some people call the Hollywood smile. It comes from the back in Hollywood, you know, in 60s and 80s, when people would, all these actresses all of a sudden would get this nice smile. And basically the dentist would cover all the visible teeth with little layers on the surface.
So veneer now is very common, and it is like everyone wants to, even if they don't need it, because it gives you like the right shape, the right size, and perfect smile. Is it harmful?
Again, there are several types of the veneers. Some of the veneers, they don't need any tooth enamel to be removed. So they could just be done by gluing the shapes of these thin shells in brighter and nicer kind of shape and color right on top of your teeth. That would not cause any harm. The only thing is people need to realize that once you have it done, you need to maintain this because a stain would accumulate around it. So you would need a regular dental appointments, regular hygienes, so the gums don't get affected by the bacteria that could accumulate around it. Another type of the veneers, now if your teeth are very dark and not really aligned, if they need a lot of change with the veneers, then in some cases we do need to remove the tooth structure in order to make them nicer and, you know, more perfect. These type of the veneers could be harmful, obviously, because we are removing the tooth structure. In order to find out whether you specifically need to remove it or not, we have to have a proper assessment to design the smile, and obviously we always try to be as minimum invasive as it's possible. I would always ask my patients, are you sure you want this? Let's start with teeth whitening. Because trust me, once your smile is whiter, you're gonna love it already. And there is then probably 8 out of 10 patients who would come for veneers would get away with just teeth whitening and some composite bonding. It's a procedure where we just add to the edges of your teeth.
So like reshape them.
To reshape them a little bit. So it's a minimalistic, because nowadays in 21st century, although a lot of people want that perfect smile, they also want it at no cost to their teeth, right? They don't want to damage, because people now realize that it's unhealthy, and they want it to be naturally done as well.
Yeah.
So therefore, it's a good combination of teeth whitening with some reshaping and resurfacing of the teeth that could be naturally done. Again, at zero cost to the tooth structure.
Yeah.
And that would give you a lot of, I have quite a few examples of my Instagram page where I've sent you the few photographs which we could just use to show as well.
Yeah.
And this is just achieved by simply teeth whitening with composite bonding in the end.
Okay.
But again, after we do the teeth whitening, so we always start with minimum procedures such as just hygiene, teeth whitening, composite bonding. If after all that you still want them to look even more kind of bright and whiter and nicer, then we could get on with composite veneers or porcelain veneers.
Okay.
Now veneers, if they are done from the composite, it's literally the enamel that we glue around your teeth to make them nicer shaped. As you said, it's a very artistic job that we do, because I do it literally with my hands in the clinic. So we sit the patient, we add some enamel on top of their teeth, and we look at it with the mirror. And if they're happy, we just carry on kind of with the same kind of procedure. If you want something more longer lasting or even kind of more perfect looking, then it's a porcelain veneers that's done in laboratory. And it's a thin shell of a porcelain being glued to the surfaces of your teeth.
So we covered veneer, and is there something else we can add to the teeth to give it the perfect shape? We talked about it before the show, but I wanted from you.
Yeah, so basically it's the composite bondings.
Yeah.
And composite veneers or porcelain veneers. So these are the things, but people give it different names.
Yeah, that's what I mean.
Some people some people call it Hollywood smile.
Yeah.
Some people call it designer smile.
Yeah.
Or there are also different companies that are Lumineers. There's different companies that fabricating these veneers, such as Lumineers. Basically, the idea behind all this is the same. It's an artificial layer of material being added to the tooth structure.
So the difference is not the technique itself, the difference is the name of the company.
Exactly,
Yeah,
yes. It's the name of the company, because in the end of the day, we still need to assess your teeth. You cannot add the same material to everybody.
Yeah.
A lot of times people would need a combination of materials. In some teeth we could just do whitening, whereas in some ones we could add the veneers. So it's not always 32 veneers covering your teeth. So it could be a combination.
Or they can be like, they can do part of the teeth. Like what I notice that people tend to do the front teeth and maybe not do the back ones. So if it is more to give them confidence. How the teeth whitening or veneer affects the confidence? How
it's
much?
immense. It's immense. I love just to see how patients would come to the consultations saying, I hate my smile, I never smile. It's literally very hard, because we always take professional photographs before and after the procedure.
Yeah.
It's very interesting to watch that natural shift in the way people smile, because in the beginning when I would ask a person to smile, in many cases they wouldn't even smile, they would just show off the teeth a little bit,
Okay.
And then in the end, that glowing big smile, it comes off natural, because now that they don't have that problem. Also, smile is a massive part of your face, of your character. A lot of people are quite confident and quite happy in their lives, and they want to smile, but they can't because of that problem. Another problem I encounter is people would go to different dental clinics throughout the world, in different parts of the world, and people being told that they cannot have this or they cannot have that, they can't straighten because they're too old. Nowadays everything is possible, and everything is possible. Obviously we need to assess it to understand what things are best for you, but we can always, in 99% cases, we can always do something to improve that smile,
At what age they start? Do you see young people?
With teeth whitening, according to the guidelines that we follow, you can only whiten your teeth after you have hit 16 years old.
So after 60 always.
Before then, I would even wait until 18, to be honest, just to be on the safe side, because your enamel has not fully developed yet. And obviously you want your tooth structures to grow completely, yourself to grow completely, to your facial features to form, and obviously before you go into that cosmetic.
Maybe in that age, how sure you will be about what you want to do in your teeth.
Exactly, that's another thing. That's always is always an issue. On the other hand, we have at that age, if you have very bad teeth, if your teeth are genetically stained or misshaped, or you cannot really smile, it affects your personality. And I had patients being bullied at school because their smile wasn't looking good. So in those cases, I always try to help with more safe procedures, where we reshape the teeth in a natural way, so to give that confidence to kids, so then while they grow up, their character is being formed in a more natural and happy way.
That's like special cases more.
Exactly.
I had a question. It was a bit funny when I've said like you will be my guest. Is veneer forever? There's nothing stays forever, but I want you to answer her question.
Yes, it's a very common question. Thank you for asking, because any treatment that I do, I get this question, and we get to discuss with patients how long is it going to last. It all really depends. There is nothing forever, nothing. Teeth whitening or veneers or composite bondings, all these treatments are to change the way you smile, but they do need maintenance, and they do need to be looked after every 6 months as normal. In some special cases, maybe even more often. And if you've looked after them nicely, if they've been cleaned, polished, if your diet doesn't contain a lot of stains, then they would last longer. Okay, if you've abandoned your teeth, you didn't look after them, you don't see a hygienist or a dentist, obviously it wouldn't last as long. So on average, veneers would last from 10 to 15 years. I see cases lasting much longer than that as well, but they don't look the same, obviously, because the gums around it would change, the teeth change, we change, in 15 years, everything changes, and the way the teeth are positioned would change. Therefore, on average, as a rule of thumb, we would say that the veneers would last 10 to 15 years with a good care, obviously. And there are some cases where we do other sort of treatments, less invasive, where there's zero damage to the tooth, such as composite bondings. They would last less. They would last 5 to 10 years. 5 to 6 is average, but then with good care, it could last up to 10 years. But again, that requires a lot of maintenance.
And when they come back, is it changing the veneer?
Yes, in some cases they need some polishing, some just retouching, some repairs. In some cases they need to be changed completely.
If I will say, give us tips and hints about how to take care of our teeth, but please don't say avoid coffee.
No, I won't do that to you.
But it will be.
I will be honest, I love my own coffee myself, and I like tea, and I actually have it every day. Therefore, I never ask my patients not to have this or that. You can always have all these things. It just means that you need to look after your teeth a bit more after that. So the good tip that I always give in terms of keeping your teeth white, because our teeth stain with anything that you eat or drink, right? So the tip that we always give is try to have your coffee in one go, kind of have your cup of coffee in the morning, just drink it, and then rinse your teeth with water to remove the stains. Because a lot of people, they have this coffee and they keep sipping throughout the day, especially those who work in the office environment, and they have this bad habit of having this coffee in front of them. It could be wine or it could be anything else. So the best it would be just to not expose your teeth to the stains regularly throughout the day, but to limit that exposure to one off time. Drink it and just rinse with water. That way you would only get these stains once in a day, and you rinse them off and the teeth are white for the rest of the day. And another thing is that you could use a straw just to avoid.
I saw that and I found it quite weird.
Quite weird. It's okay with a cold coffee and things like that, but not. But again, it's just a little trick to use if you've just had your teeth whitened and you want to maintain that nice result.
So the straw will prevent it from kind of traits.
From exposing your teeth to the stains. Like it would still be in your mouth, but it would be to the lesser extent that if you've avoided touching them completely.
Okay. If someone decided like I'm gonna start by changing my smile today after they watch us, where they will start from?
Well, they need to give us a call. Or basically the good start to do that, to have that smile transformation, is to start with general consultation. I would always see patients for a consultation, and we would discuss, we would take some photographs, we would smile, we would laugh, we would tell just some life stories, because that's when you actually interact and you see how much are you showing your teeth.
Yeah.
How much you're not showing them, you're trying to hide them off.
Also, you try to look at this point, how
Yeah, I've been looking
confident
at you
they are.
actually all this time.
Now, are you looking to my teeth?
Yeah, I'm just kidding. But in any case, yes, this is what I would start with just consultation, trying to assess what you need. Not everyone needs teeth whitening or the veneers. Some people would benefit from just getting some dental hygiene to remove the stains, and they would have amazing teeth already. Some would need that little intervention. Some would need even more intervention. Therefore, to assess them and to design that smile first.
Yeah.
Once the smile is designed, we can actually fabricate this, we call it a wax up or mock up, where we put that veneers before they're being fabricated, but the try-in veneers into your mouth. You can walk around with it and you can have a look and assess, is this something that you like
Oh,
or
that's
not?
interesting, because you don't need to make that decision, which
No.
Yeah.
No. It involves a lot of planning.
Yeah.
I always try to avoid having the treatment done on the same day, because it's a big decision and you're going to be stuck with it for years. So
Yeah, that's true.
you better know what you're getting before you commit to it. Therefore, the try-in veneers is a good alternative to kind of, you can have it. You walk around with it. It's on your teeth. It's not as perfect, but it gives you some general idea as to the color, shape, generally.
Yeah.
And you will be surprised, but, well, in most cases, people would then love it. They wouldn't want to take them off even.
Yeah.
But there are some cases when they would look at them and think that it's a bit too much and go for an alternative treatment. So it's good to visualize.
You reminded me of something. I don't know if I can call it funny, but the one which you put them if you have occasion and then just take them, like, I don't know what they call,
Yeah,
but
that's awful thing. I've seen it on social media.
it's
being
social media. That's
advertised.
exactly what I saw.
No, that's an awful thing. You
So what is
cannot
it?
possibly, you can, it's just something being sold to people as always. You cannot possibly talk with it or
So is it
function
like
with it.
something you add, I don't know, you add to your teeth during
I've
a night
seen that.
out? And
I can see using that for one day on a Halloween maybe, people would put it. But other than that, it would affect your speech, you wouldn't be able to eat with it, your function and your smile. I'm not sure how these things work, but I did see the advertising. Actually. It was
Advertising,
looking
that's
funny, yeah. It's just this bulky thing on your teeth. No, it's a bit more complicated than that. I'm
yeah,
afraid.
and also I think it's like people want it, but maybe they don't know how to go about it. So they try to use it for photo shoot or for social media. Or I don't think everyone is aware to what's available, or that's why they go to supermarket and buy a kit and do it
And it's
themselves.
easier. Some people are scared of dentists. They don't want to see it, and they think it's easier to just order something online. But I'm sorry to disappoint, but there is no thing like that. You cannot just order something and put it in your mouth and expect it to work. It's impossible.
Yeah,
It's
yeah.
not. It doesn't exist yet. Anyway.
Yes, that's true. In terms of cosmetic, we covered it, but if you have cases who they have already like a damage to the teeth and they need work, do you do posts like cosmetic?
Absolutely.
And,
So I love doing restorative treatments because this is what people actually need. If you have damaged teeth which need crowns or they need veneers because the teeth are badly broken or badly damaged, this is the most rewarding sort of treatment to me, because that way you fix both. You fix the health of the teeth, at the same time you make them look beautiful as well. So in many cases I would do, people would actually need to have them done. In some cases where people already had old veneers done elsewhere, and they wouldn't be happy with the way they were made, or they've been old, they need to be rechanged, then in those cases, we have to do the veneers. We are kind of stuck with that option. We cannot just whiten because veneers wouldn't go whitened.
Yeah.
So we change the old restorations to the new ones. Yeah.
And we hear of a designer smile. Is it similar to Hollywood smile? Is it something different?
It's another name.
Another name.
It's another name. It's basically, it's basically the names people call to the smile makeover, smile transformation, where you add something to your teeth to make them look more beautiful, more even, nicer.
Yeah.
And a lot of people trying to find this alternative because they are scared of damage to the teeth, and they go for these lumineers or the designer smile. But the answer to this question is yes, the veneers can cause no damage to your teeth. But not always. So we need to approach this case by case and assess your teeth.
Yeah.
And in many cases, we try to create really no damage. But in some cases, we have to remove some tooth structures in order to get the veneers done.
In some cases, I'm sure like people who want to have a problem and get it solved. In other cases, it's a trend.
Yes.
So like longer from the front, diamond shape, that's a new thing I've heard of. So do you have this type of clients who they come because, oh, now the trend have changed and I want to change how my smile look?
To be honest with you, I do, but it doesn't necessarily mean that we do those treatments. Because if someone comes to me wanting just to change the shape of the teeth, I do have it. I had a patient recently who came and asked me to shave down my teeth because they look too long. No, we don't do that. We would always look at it and discuss this and try to explain to patient what's healthy and what's not healthy.
Yeah.
As long as, but there are some cosmetic changes because I understand that I'm a human being. I have social media. I have a big account on Instagram and I'm in it as well. So I also understand the necessity for people to look good, to
follow the trends.
To follow the trends and have that bright smile. So obviously we try to give that bright smile, but in a healthy way. Yeah, so I would not give the diamond shape to people, but I would give a nice, healthy looking, natural looking white smile. I think everyone deserves that.
Yeah, definitely.
Yeah.
Dr. Kamala, you've been an amazing guest. Thank you so
you.
much for all the advice and sharing your knowledge with us. I personally enjoyed the show.
Thank you so much. I enjoyed it too. Thanks a lot.
Thank you. And for you, my viewers, stay tuned with me, Lin Hussin, on ALB UK TV, Beauty Matters.